In this video, we'll debunk 4 myths about healthcare access for qualified immigrants in the state of Texas. Who's a qualified immigrant? A qualified immigrant is one of the following: someone with lawful permanent residency, also known as a green card holder, a refugee, an asylee, a TRU visa holder, or a humanitarian immigrant, which includes VAWA self-petitioners or special immigrant juveniles. There are also other immigrants who qualify, such as certain Cubans and Haitians, and some granted parole or withholding of removal. If you don't fall into one of these categories, please watch our second video. True or false? If I'm a qualified immigrant, I'm immediately eligible for Medicaid benefits. False. Depending on your qualified status, you might have to wait 5 or 7 years until you become eligible for benefits. Under certain qualified immigrant statuses, you might also need a green card in order to gain eligibility. If you become a U.S. citizen, you are eligible for all Medicaid benefits. This is regardless of your naturalization process or of the immigration status of your parents. All benefits eligibility depends on meeting other Medicaid requirements, including income eligibility. True or false? If I'm a qualified immigrant, I'm eligible for emergency Medicaid benefits. True. All immigrants are eligible for emergency Medicaid regardless of status. A qualifying medical emergency requires the onset of emergency medical conditions and severe and sudden symptoms. A qualifying medical emergency may include things such as labor and delivery, but typically excludes things such as organ transplants and outpatient dialysis. Always seek medical care in an emergency. ER departments cannot turn you away due to your immigration status or lack of coverage. True or false? If I'm a qualified immigrant, I'm eligible for CHIP. True. In the state of Texas, all legally residing children, including qualified immigrant children, are eligible for medical assistance. In addition, anyone who is pregnant can get care through the CHIP perinatal program regardless of their immigration status. This includes prenatal, natal, and postpartum care. True or false? I can have an interpreter assist me while seeking health care or applying for health insurance. True. While seeking hospital or emergency room care, you have the right to a free medical interpreter. This includes bilingual staff, telephone interpreters, or in-person interpreters. When you apply for Medicaid or CHIP plans, you can also request a free interpreter.